Great news, guys. My mom gave me AIDS.
Oh. Here, have some coffee.
So my friend Susan was attacked by birds.
How are they working, dear? Do you want to turn up the volume?
Oh, I forgot you could do that. So, Tim, how's everything been with you? I really want to hear.
Oh, you stepping it out, John. Well, actually I joined a leather club, but that was actually sort of beginning.
Well, if you're still here, I'm amazed because you got this fancy code already. So you could have bolted, and most of you didn't bolt, so you might be interested in this topic, I guess, is what I will conclude from the fact that so many of you are still here. You know, I wanted to start a little bit. You know, you've been in here since 12:30, and you've heard a lot. There's been a lot on telehealth, really how to apply it in an audiology practice. The panel was fantastic. I actually took notes. I got out a notebook when you guys were talking because I learned some things that I hadn't thought about, and that's not surprising since I'm not in a clinic every single day. But I think there were a few take-home messages, I think, for me, and I think I'll just summarize a little bit. You know, Steve came up and he said, you know, why are we talking about this? Why telehealth? And I really think spoke to this is the future. And I think we're seeing it as consumers of healthcare. I know our healthcare provider for ReSound has, you know, doctor on demand, and they are asking us to use it. They would rather us go use doctor on demand than go in for a patient visit. So we're being encouraged as consumers of Blue Cross Blue Shield to actually use it. It is the future. Telehealth is clearly here to stay. But I think, you know, the way that Steve talked about what does that do in a practice? How do you use it in a practice? Hopefully, you know, you got a lot out of that. And I think, you know, some of the things that are key in the understanding there is the patient engagement. The patient is way more engaged in the telehealth. And if you think about remote fine tuning and how engaged they are in the fitting, when you have to request and you have an app that has so much personalization to it, that you have a huge amount of patient engagement that certainly, you know, we weren't able to give before. I loved the conversation the panel had on the app. And I say that because we've done some studies looking at ReSound Links Squared versus ReSound Links 3D. And just trying 3D on patients that are happy users. They purchased binaural pairs of ReSound Links Squared, tried the 3D, and they're extremely impressed with the app, so much so that many of them were willing to buy a new pair of hearing aids so that they could have the app. And you think about the customer experience that it gives. Thumper alluded twice to the speech clarity button. And it's just a quick button right on the very first page that you open up the app. You hit speech clarity. What it does is it just boosts the high frequencies just enough that speech understanding is going to be a lot easier for a patient. Those same high frequencies, if we build them in full time, will be the patient who comes to you and says, the hearing aid's too tinny, I don't like the sound quality. But give it to them in noise when they're struggling to hear, and you've just made the difference between whether they can understand the conversation or whether they just drowned in the noise. There's another quick button on there that's a noise filter, and again, Thumper alluded to it. You push on the noise filter, and there is a very audible change in the level of the noise going down, the comfort factor. They know that that's different. And those quick buttons are there Yet you have a level of personalization beyond that in the app. You can actually go in and change the noise reduction settings, the wind noise reduction settings. You can change the directionality and how narrow is the directionality, how open is the directionality if you're using more traditional directional systems. So the level of personalization in the app, and then the fact that you can do telehealth and request assistance and rate your settings. It is part of what Steve spoke to. It's that patient experience, it's that customer satisfaction and all the things that he spoke to and how to integrate that in your practice. I think in the panel, you guys said a lot of things that I would say again. My favorite, number one, the fact that you're using the app to download new settings in the office. I had not heard that before, and it's brilliant. I mean, it really is. You don't have to hook up. You are just sitting right there at their SmartFit. You're making the changes, and you upload them to the cloud. They're sitting there with their phone. They upload them to hearing aid. You're showing them, again, how the app works, how simple it is, and you're not having to hook them up. And it's just a great experience, I think, for the patient. Chad talked about it as a market differentiator. And I think that's a piece that maybe is underutilized today. And, I get the opportunity to travel with our sales reps. They don't think I'm a burden, which is a good thing, because I get to go out and help them with their patients and such. And I was out last week in California, and market differentiator came up over and over and over again. How do you differentiate yourself in this market? And I think, Chad, you hit the nail. It is that market differentiator. It's something that you can do different than someone else, because you can offer a service that no one else really is offering. I like the fact that the panel pointed out that if the person has a smartphone, introduce, tell them about it. I think we hesitate who's going to be able to do this and who's not. I mean, if they have a smartphone, they're probably pretty proficient anyway. I know, I have an 81-year-old mother who is very proficient on her iPad and would have no problem using this at all. So I think don't assume, let everybody know. I like the fact that, you don't make the assumptions. Everybody gets introduced to the concept. Everybody knows that it's there so that everyone can have that opportunity to use it. I think it was Jana who said, we come in the morning, and we look at the requests in the morning, and we deal with them in the morning, and then we move on through our day. It doesn't have to be something that you change your practice or you have to answer within, the first 30 minutes that the request came in. We personalize in that web portal what you want to say back to the patient. So you tell them, you're going to hear back from us within 24 hours. Or if that's too fast, tell them within 24 to 48 hours or 3 to 5 days. Whatever works in your business model. But you don't have to change really everything you're doing. You can just, one time a day, go ahead and look at those requests and make those changes. Jana, again, calling them after you make the change. It's perfect. You go in, you make a change, and you're giving them a call. You're saying, hey, we know we sent you these. That's even better than rate my sound, because you're actually getting that feedback, that personal connection between you and your patient that, of course we all want. I'll take your questions all at the end, or probably just have come up to me. The practice management part on the statistics. I think we have just in May come out with a new version of that web portal, and we actually expanded the statistics quite a bit. But I think there is more that we can do. I know, Chad, you said a couple of things you'd like to still be able to see in there, and I wrote those down, just so you know, because I think there is more statistics that we can have, as we move through the app. I think the last thing I'll say before I kind of move on to this future part is Steve's last slide, said, what do hearing healthcare professionals think of this, and what do patients think of this? And our CEO calls them North Korean numbers, and it makes me laugh. But 100% of hearing healthcare practitioners who use remote fine-tuning recommend it, 100%. So people are using it, and they are finding it to be very useful when 100% that are using it quite a lot are saying, you should use this. I think the other thing to call attention to is patients actually did find that their problems were addressed in using it. So it was a very high number where they actually did have their problems addressed. They got a better sound quality. They got a solution. I think that, and it was touched on in the panel, those first couple of weeks where we don't see a patient because they haven't come back for a check, so much can happen right there. And if that first few days isn't a really good experience for them, we may see those hearing aids coming back. Remote fine-tuning allows you to have a good experience, to know what their experience is right away with the Rate My Sound or just having them doing a request to you. So anyway, that's all of my summary of what's gone on today, and then I'll move on a little bit into the future. I think talking about the future, anytime I'm asked to do this, I cringe and don't like it, and it's a very tricky situation because clearly I know the future, at least in this company. And I think, you know where things are going, but, we patent things and we can't talk about exactly where we're going for obvious reasons. But I want you to get something out of this and thinking about where the future could go. And I think when I talk to groups of audiologists, even when I talk to my students, I actually am teaching advanced hearing aids right now in Chicago, they really don't understand about data analytics and machine learning and artificial intelligence. They're kind of these big words out there, and your eyes roll in the back of your head, and I don't know if that really impacts me. The reality is that it's impacting you already. It's impacting your lives every single day today, big data, and has the ability, to continue to impact your lives quite substantially. So I'm gonna start out. How many of you watched a Final Four game? Lots of hands, I'm sure. We're obsessed with college basketball, right? When it got down to Kansas and Villanova, I was on spring break, and my 13-year-old, who's a huge basketball fan, would not go to dinner with us because we had to watch this game. So we had to find a place where she could watch the game. It was that big. But if you watched any Final Four, you saw this commercial over and over and over again. You guys remember seeing that commercial? It was on all the time. What does the data show you? And there are multiple sets of this commercial, but it was all Google Cloud and data is there. And that one spoke to me the most because how much noise makes a difference. That's interesting to us as audiologists, of how much noise, because we probably don't want it to be that much. But they have, you can answer some of these questions. These questions come up and they can be answered by analyzing big data or big data sets that are enormous and you can look at over years and years and years. I think when you look at data analytics today and just in the last years, think about data storage. Not everyone in here is a college student. Many of you had a floppy disk, I'm sure. And many of you store data that way. And then we have, graduated to being able to store a whole lot more data. And now we are storing massive amounts of data. And data is created just by the second. Huge amounts of data and being stored in clouds. Last week, again, while I was on my way to California, Mark Zuckerberg was testifying. And I thought, this is really a great time to have data become negative. Because clearly, data used in the right way, with the right privacy controls and stringent privacy controls and meeting HIPAA standards and meeting the European standards, This kind of data is extremely powerful and can change our lives and do great good, which is not exactly what it did for Facebook. So don't be negative on data, because data can be used in a very good way, and those are the kinds of things I want to talk about. But when you look at big data, this is an area of research that is fairly new. You're developing intelligence, looking at the data, algorithms that are pulling things out of the data. And I think you've probably talked, about big data. I saw this cartoon recently, and I thought this is a perfect cartoon for this audience. Someone was dressed as big data, and the guy at the door faints and says, see, I told you that big data was too scary. And I think so many of us, audiologists, whatever we do, if this isn't a part of your life, doing big data, I think it is scary. I think you look at it and go, what the heck are they going to do with this big data, and why does it impact me? It does impact you. It impacts you every day. I recently read this long article about Walmart and how Walmart is using data analysis every single night to basically rearrange the shelves in their stores. And it was a long article. It was an article about, they look at the data and what did they sell that day and what do they still need to sell and where was it located on the shelves and where was it located in the store. And they actually will rearrange where the product is based upon the data analysis. So it's being used. It is impacting your life every time you walk into a Walmart. I read it about Walmart. I'm sure it's happening in many other places. Even better kind of use for good is, feeding the hungry. Big data is being used to know where crops should be planted, knowing how to rotate crops, knowing where they grow best. Those kind of things are being used and optimized in order to have better crops and produce more food. Fitness. Probably a lot of you have a fitness tracker on. I usually wear mine, but it doesn't really go with the suit. So as soon as I take the suit off, I'll put my fitness tracker back on. But there's reams of data being collected on fitness and lifestyle, and they're coming back and telling you how to change your lifestyle based upon that kind of data. How about crime prevention? Big data can be used on where was crime? Where is it happening? Where is it happening near? There are just so many questions that are being asked, and resources are put in the right areas based upon how that data is analyzed. So let's bring it a little bit closer to health. I just saw this on Twitter the other day. Here's an iPhone with a program that's being used to look at skin cancer. So using that, artificial intelligence, some learning about what does that skin cancer really look like, there would be huge data sets that would have had to have been analyzed in order to develop a program that can literally put this on a phone, kind of microscopically looking at it and saying, yep, that's skin cancer, without having to biopsy it or go through all the things that we do. There's a term that you may or may not have heard called precision medicine. And you can read the definition up there. A medical model that proposes the customization of healthcare with medical decisions, treatments, practices, or products being tailored to the individual patient. In this model, diagnostic testing is often employed for selecting appropriate and optimal therapies based on the context of the patient's genetic content or other molecular or cellular analysis. So precision medicine is saying you are all different. Every single one of you has different genetics. You come from a different place. You live in different environments. You have a different molecular and cellular makeup, and we can treat you better if we can look at those things and then use huge data sets to see what happened for patient A who had a certain genetic makeup and what happened for patient B. Just the mapping of the genome, which has not been that long, has really kind of started to drive. Cancer treatments for sure being very individualized for patients. Yeah, I can tell you in my own family, my mom has a genetic heart condition, and it's very lethal. It's a condition where you just, are walking along one day and you die. And my mom has this condition, and we've known for about 20 years, and she's still around, but we've known for about 20 years that she has this condition, and we've also known it's highly genetic and that it can be developed anytime in life. And so my mom has 4 children, 9 grandchildren, 5 great-grandchildren, and every single one of us has had to have an echocardiogram about every year since we knew about my mom's condition. Until about 5 years ago, they found the gene. And she was able to be tested, and then they determined what gene it is, and all of us were able to be tested, and we no longer have to do that. So the mapping of the genome, knowing that individual genetic makeup, and there's a whole lot less echocardiograms having to be done. It happens in every household with every disease, cancer probably being the most prominent. But I want to show you a video a little bit on precision medicine.
Precision medicine. You've probably heard the words on the news or even at your doctor's office, but how does it affect your life right now? Precision medicine is basically a modern approach to understanding health. Take asthma. Asthma affects more than 25 million Americans, nearly 1 in 12. They all have one thing in common, a condition that makes breathing difficult. In most clinics, these patients are treated with an inhaler and the same drug, albuterol. But are 25 million people all the same? If you have asthma, your condition depends on where you grew up, how old you are, and your ancestry. It also depends on the air you breathe and if you have carpets or pets. Every patient is unique, so one-size-fits-all remedies don't always work. It's not just asthma. For diabetes, cancer, and most other diseases, today's treatments are based on obvious symptoms, standard tests, and common drugs. Precision medicine, however, starts with creating a clear picture of health by collecting, connecting, and analyzing many kinds of information. This could be data you provide from your fitness tracker, or it could be what scientists are learning in their labs right now about the underlying causes of disease. Genetics, your health history, and other details are added to the mix. When we integrate such data from millions of people, your clinician and researchers can understand your health risks, how others like you responded to a disease or drug, ways to prevent disease, and what makes you unique. So we can stop focusing on diseases and care for you as an individual. The more information we collect and connect, the better scientists will understand health. And as that knowledge network grows, we can ensure that every patient everywhere gets the right treatment in the right dose at the right time.
You can go onto YouTube, and there are many videos on precision medicine and where it is being applied and how it's being applied. It's fun to go in and watch some of the things. But I think from an audiology point of view, we need to take it to that next level, which what is precision audiology? And we at ReSound are uniquely positioned in this area because of the cloud and because of what we're already doing with remote fine-tuning and with Rate My Sound, and being in a position to be able to use big data analysis to actually help patients clearer, more personally in the future. We already talked about the app a lot today, but we talk about Rate My Sound in particular. So you guys heard about Rate My Sound. You basically rate your current fitting, you rate a remote fine-tuning, you rate one from in a follow-up visit that you have. So all the time you can do these ratings, and they provide good communication. You're going to see them in your web portal and everything, but they also provide for us what works and what doesn't work, and in what environment did it work, and what fitting worked, and when they went into noise, what on the app did they change? And so there are many things that we can glean from remote fine-tuning, from the app, from the data that we can see. We've already gone through how Rate My Sound works here today, so I'm going to just skip this part. Just take me a minute. Then are we done? No. There we go. We got to go back. Oh, can we go back a couple slides? This one isn't taking me back. Oh, that is the next slide. All right, there you go. So when you're looking at big data, so like I said, we can collect data and collected in the right ways with the right privacy, and it can't be attached back to a patient or to a fitter or to a clinic. Collecting it with all of the HIPAA laws in place. But we can collect the data, and there's a lot we can do. And this is kind of just a hierarchy of the things that you can do with data. Things that we've done for years, that descriptive data. You just analyze that, this patient with this hearing loss is probably best fit with a superpower hearing aid or something. I mean, very descriptive type of things. But you move up into diagnostics and predictive and prescriptive, and where you want to ultimately go is cognitive. And cognitive is around what we talk about with artificial intelligence and machine learning and creating products that are smarter because we're using big data to create those products. And so that's what you're talking about with data analytics, is getting to that cognitive level of learning so that the hearing aid fitting can be better. I think just to motivate this a little bit more, all of you in your clinics have patients with exactly the same hearing loss, even exactly the same speech understanding scores. And one of them does extremely well with the hearing aid, and one of them returns the hearing aids for credit, doesn't get benefit, they don't like the hearing aids. Why? There's been lots and lots and lots of research done in this area. When I was an academic, speech understanding and aging was my primary research area, and we looked at what are those differences when two people have the exact same hearing loss. What makes one of them a great hearing aid candidate, and what makes one of them a not so great hearing aid candidate? And we have some answers there, but we don't have very clear answers. And there's a lot still to glean from that. And if you think about what can we do? I mean, can we learn what works and what doesn't work, and looking at the patient's hearing loss and their understanding scores and all the kind of data that we can get back from these things? Can we ultimately help patients whose hearing losses are extremely individualized? These hearing losses, some have outer hair cell damage, some have inner hair cell damage. There are mixes of these. Hearing losses may look the same on paper, but they're extremely individualized. That's where big data comes in audiology. How do we take all of that data for that one individual patient and prescribe the right fitting with that, the right setting? So, this is the kind of stuff that for hearing aid researchers, this is very exciting where we can go with this. Why do some patients like one sound quality over another? You can create what you believe would be the best sounding hearing aid. You're listening to it, it sounds great, and you put it on a hearing impaired patient. Again, one of them will like the sound quality, one of them won't like the sound quality. Why? Those are questions that we need answers to. What is that sound quality that this patient with this hearing loss wants, and what's the sound quality that somebody else might want? How about frequency lowering? Frequency lowering is an area of a lot of controversy in our field. There's no doubt about it. We have frequency lowering. Everybody has it. We have companies that default frequency lowering on for every single patient. But is frequency lowering really supposed to be on for every patient? And who are the right patients that should have it? Because you can't predict it on the hearing loss. You could have a hearing loss that looks like, why would you turn on frequency lowering? And then that patient ends up liking it. Another one that would be obvious that frequency lowering might be of benefit, and they hate it, and they won't accept it at all. So another question, I could go on all day with the questions here. What's the right fitting at the first fit? What's the right fitting at 2 weeks, 3 months, 6 months? I can assure you that the right fitting at first fit is not the right fitting 6 months later. If we stay with our first fits and don't change them after the first fit, the patients, unless they have our great speech clarity button on the app, they need more high frequency gain because they won't understand speech without it. So what are those, and in what environments, and can we tailor prescriptive methods and gain per environment and change those per environment? I think all of those things we can learn. So I just summarize in this slide. I think when you're looking at big data and an intelligent hearing aid, there's a lot that we can do. It'll help us understand fitting. It will help us understand when people need an adjustment, and hopefully, we can start in a better place. So it'll lead us to a better first fit if we can understand what that patient likes, and based very individually on their hearing loss and their experience and where they go and in what environments they're in. It should lead us again to better fittings in different scenes, and I just kind of said that, but if they go into a restaurant, what do they like? What is that fitting versus if they go, to a small coffee shop to have a conversation with someone? Very different auditory scenes. What should be the fitting? Today, we're more like the albuterol. It's kind of one size fits all. We put one prescription into the hearing aid for every one of those scenes. Hopefully the future we can do better. And then look at the personal. How does that personal loss interact with the hearing aid settings to have really that ultimate personalization? I mean, today we have an app that can do a ton of personalization, but the more we understand about big data and what individuals do with it, the more we can build that in, the more personalization or recommendations we can make around personalization. So anyway, with that, hopefully big data will not be scary. And you'll embrace the idea that this is kind of where we are in the future, and you'll just have to kind of see what that future holds. And so it is 3:30, and we're not going to do a Q&A, but I'm around if anybody has some questions. Steve is also around in the back there. All the panelists are around, so if there was a burning question that you had, we are here. And again, that code, if you didn't get it, was 3010. So that you can get your continuing education units. And thanks for being here. We really appreciate your time out to be here.